Hey guys, John here with Feldman. Today I want to talk about your rehab. Is it supposed to be painful? Are you going to be in a lot of pain during your rehab? The short answer is your rehab and your physical therapy should not be excruciatingly painful. Okay. The more complicated answer is yes, of course there are times that you're going to be in a little bit of discomfort, especially since you're going to be working through some sort of pathology, some sort of injury or some sort of pain or an issue. But by and large, when we're talking about your rehab in general, you should not be anticipating your PT sessions, your rehab sessions, with a really disconcerting approach, right? You should not be unhappy, or you should not be looking forward to your PT sessions and saying, "Oh man, this is going to be really painful. This is not going to be fun. This always hurts." Blah blah blah. Yada yada yada. That's not what we want you guys to experience. Okay. I think intuitively, when we're talking about joint replacements, either a hip or a knee or some sort of post-operative shoulder procedure or an elbow fracture, things like that, yes, obviously there are things that are going to be a little uncomfortable, but honestly, gone are the days, or gone should be the days, where you were just cranking on somebody's knee or cranking on somebody's shoulder and they're screaming and you're taking them in the back room and covering their face with a pillow so that they're not interrupting everybody else that's in the facility. That's not what rehab should be about. Okay. We have significant studies and research to show us that long-term outcomes are identical. They're the same with conservative approaches and very aggressive approaches. And again, sometimes it's easier to see that we're talking about a knee replacement and just forcing the knee to bend or forcing the knee to straighten, or a rotator cuff repair and we're forcing rotation, one way or another. Those are probably the easiest anecdotes that I can give you to understand what I'm talking about. So honestly, we choose to use as pain-free techniques as possible, right? We really try to impart as little discomfort as possible on our patients for a number of reasons. One of them, pain is just not fun, right? Usually you're coming to see us, you can get out of pain. Number two, pain is a funky thing with the body, right? If we instill a lot of pain, or if we're using very painful techniques, you're going to tense up. All right, if I can explain this at its simplest form, you're going to instill some sort of guarding mechanism within your body and you're going to tense up. If somebody's going to crank on you or do something really painful, I don't care how good you are, you're going to tense up. Your body's going to be tense, and you're creating this association with that technique or that office visit or that person that your body's going to tense up and it's always going to be uncomfortable, right? This is operant conditioning at its finest. So, if I have a patient, and they, I was a student and, I was at these rotations and they just forced us to crank on somebody's knee, and yeah, it's going to be uncomfortable, but guess what? We have to get to 90 degrees by next week, and I'm just cranking on their knee and they're really uncomfortable. Well, guess what? Every single time they come in to see me, they're already thinking, I got to prepare myself for this. This is not going to be good. And they get tense, right? Like, okay, prepare myself. 3, 2, 1, go. That doesn't help. Okay. It was really eye-opening when I took a course with a gentleman who is an excellent manual therapist and has some great approaches to dealing with painful areas, and that really changed my approach to treating. I really don't like to use painful techniques on people. I'm going to give Lindsay a shout out here. Lindsay's one of the trainers of the gym. She tore her ACL a couple years ago, and she came in and her surgeon told her that she had to be at 90 degrees by next week, and this was like week 1. I'm like, yeah, okay, that's possible for some people, but some people don't get there. And guess what? It may not happen for you, and that's okay, because the motion will come. We don't have to get there right now, right this second. And sure enough, she was close, but not there, and she was told it was an issue. And I said, don't worry about it. You're going to crush it. You're going to kill it. And we were at, I think, well past that. We were at 115 degrees by her follow-up, and she was all excited to go in there, and she came back and she was like deflated. I'm like, what's going on? She was like, he didn't even say anything. He didn't congratulate me. So I always thought that was kind of funny, but with knees, it will come. We don't have to force the issue right now, as long as we're making continued progress. Again, long-term outcomes are very, very similar, if not identical, to conservative approaches versus very aggressive approaches. So whether it's the knee, whether it's the shoulder, whether it's the elbow, or whether it's non-surgical or surgical, again, we really try and avoid these painful techniques. They're really not necessary. It doesn't mean that they're going to be any better than using a conservative approach. And so, again, I don't mean to keep this super simple. Again, I'm not saying that you're never going to be in any discomfort. We're just really not going to have you biting your nails or your lip and pounding on the table and screaming in pain. Honestly, that's very counterproductive. So We've had a lot of success doing doing things this way and using this approach for our patients, keeping you very as comfortable as possible, and really using pain to help us rather than be a hindrance in the long run. So that's really it, guys. Just a little bit of our approach here. And is your rehab supposed to be painful? Is your PT going to be painful? It can get uncomfortable at times, but honestly, people who tell you no pain, no gain, or pain is weakness leaving the body, or just suck it up, it's going to be physical torture. Honestly, it's funny. It gives us a little bit of a chuckle. But anybody who says that should probably go back to the drawing board a little bit. So I'm going to be a little snarky there. It's 2022. Let's get with the times, everyone. So that's it. Your rehab should not be super painful for you. There are always multiple approaches to this. And if you guys have any questions on that, let us know in the comments. Give us a like, give us a subscribe. We appreciate you guys watching these videos. And we really want to hear from you. So tell us your experiences, the good, the bad, and the ugly. And we'd love to have some conversations. So tune in next time. But thanks again.